diabetes mellitus. This is also most common disease all over the world, most burning and most suffering disease all over the world. Please see what is happening. So, diabetes means high blood sugar levels, uncontrolled blood glucose levels circulating in blood. So, that is diabetes. There are various reasons, mainly two reasons. We know that there's a hormone called insulin hormone is produced in pancreas, and it is useful to reduce the blood glucose level by its action. So, there are main two types of diabetes, type 1 and type 2. Type 1 most common in young people and childhood, and and type 2 is most common in adults. What happens in type 1 is actually insulin production is defected due to autoimmune condition. What happens in type 2? Type 2 means enough insulin is there, but there's a resistance of tissues, fats to this insulin action, and so no mean of available of insulin. So ultimately what happens is blood glucose level not reducing up to a normal level. This is the simple reason. So when we talk about diabetes, we want to identify by symptoms. What are the main symptoms of diabetes? According to type 1 and type 2, onset, appearance of symptoms, distribution, all those are different. I am commonly talking about diabetes for type 1 and type 2. Type 1 and type 2 diabetes, we can recognize the symptoms early in type 1 but late in type 2. However, common symptoms are thirsty, frequent urination and nocturia, urination at night, dry mouth, and food ulcers, reduced vision, hearing loss, and some gum bleeding, gum defects, and also frequent infections, vaginal dryness, and some erectile dysfunction, and fatigueness, non-healing sores, and tiredness. Those are the main symptoms of diabetes. So, someone has suspicion, he can test for diabetes and confirm the diabetes. So there are symptoms. So you see, it has short-term and long-term complications. What are the short-term complications? Blood glucose will be high in type 1 and type 2 due to higher levels, roughly 600 milligram per deciliter. It causes diabetic ketoacidosis and hypersmall state. So that is the elevation of glucose level. So due to reduction, it is called hypoglycemia. Those two conditions, hyper and hypoglycemia, those are emergencies. So we have to act immediately by the treatment to reduce or alleviate upward hyperglycemia. Those are the short-term complications. What are the long-term complications? Long-term complications are, it affects eyes called retinopathy. It affects nerves called neuropathy. It affects then kidneys, neuropathy, other than heart, then atherosclerosis, heart attack, coronary artery disease, and it affects the brain, strokes, likewise long-term complication. Other than that, null-healing foot ulcers and numbness, tinglingness of hands and legs. Those are the main things. How we can prevent or how we can control the diabetes? Mainly with our lifestyle changes, we can control other than oral and injectable medicines. So, what are the lifestyle changes? We can control our diet, reduce carbs, and reduce saturated fats. We can do regular exercise at least 30 minutes per day or 150 minutes per week. Rest, adequate sleep, and stress management, and then we can maintain good weight and limit alcohol and tobacco. Those are the main things to control, prevent diabetes. Other than that, there are medication. Oral medications like metformin, vicosite, such as such medication. And insulin injection, those are the main medication. So, other than that, we want to know how we can diagnose. We can use simple tests, tandem or fractional blood sugar. Then for long-term control, it be A1C. For pregnancy, oral glucose tolerance. Those are the main briefing of diabetes. If you want further clarifications, you can comment and message. I will reply.